So my biggest challenge was obviously my lower back, my sciatica, almost pain-free. Now I can sleep, do my sport, do my hobby, 100% my lifestyle just came back. I feel rejuvenated.
Okay guys, so I'm here with John. I'm gonna show you what I do pre-adjustment. Every time I see a patient, this is what I do, and these are my considerations in my head. With John, he came with chronic low back pain and left sciatica. So I'm gonna adjust the whole spine, and because of that, I wanna analyze the whole spine as well. When he comes in, I'm gonna check the upper cervicals to see misalignments on the spine. And I'm gonna run my hand down the spine. I'm looking for additional misalignments all across the spine. I'm looking for inflammation as well. And if I press and he says it's tender, that's also good information for me, okay? So I'm seeing the whole spine. I'm testing for muscle tone on each side of the spine, misalignments on the actual vertebra. And when I come down here, I'm touching the sacrum, right? This is the area that stabilizes the whole pelvis. So I'm looking for distortions at the level of the sacrum. There's a high sacrum on the left. That is some information for me. And I'm gonna press on the legs, subtle. If there's tenderness, he's gonna tell me as well. Is there any tenderness here?
No.
Okay. And then I'm gonna check the Achilles. I'm just checking information from his body before I do any of the adjustments. He has a chronic low back pain and left sciatica. So what we're doing is, this machine here is a decompression, flexion decompression machine, both in the same time. I have already strapped John to the machine here on the thighs and on the lower back. And what the machine will do is it will open downwards, it will flex downwards and up, creating a pump mechanism on the disc. Okay, so I'm gonna turn on down here, and I'm gonna start the machine at a velocity which I believe will be beneficial for John's condition, okay? I will come here manually and press upwards on the segment that I know is affected, okay? So right now I'm viewing, I have his x-rays here, and with his x-rays, I know exactly with which segments I'm gonna pull up, okay? So this will run for about 2 to 3 minutes, 4 minutes, depending on the patient presentation. For acute patients, this is 4 minutes will be too much. For chronic patients, we might need 4 or 5 minutes, okay? What I'm doing is I'm on the segment and I'm pushing up the segment, and the machine is pulling down on this. So again, what it will do is will create this natural distraction of the segments. It will pump open the disc and close the disc, and open the disc and close the disc. And that has a nourishing effect on the disc. It will also help the outer layers of the disc start to heal again. I'm gonna also take advantage of where we are here, and I'm gonna add a second therapy, which is the cold laser therapy. And I'm gonna come to the laser machine here. It's already set for John's condition. It has both visible light and invisible light, okay? So the visible light will be more superficial, red light for tissue healing, increasing circulation of the tissues, and the invisible light will go deeper into the tissues. Come to this region here, to the affected area, and I'm gonna slowly go across the whole area, irradiating both lights on those tissues. And again, depending on the patient presentation, whether it is acute or whether it is chronic, I will choose a different velocity, a different strength of light or power of light, and I will choose a different depth for the tissues. This is fantastic to help rejuvenate all the tissues around the spine, muscles, ligaments, tendons, the fascia. What the red light is doing is improving the mitochondrial function at the cellular level. So what it does, it rejuvenates the tissues. It's like a workout every time. It's like having 5 or 6 workouts every time. It's not gonna create soreness, but what it does is it wakes up those mitochondria and cells so that it will start decreasing pain. Because pain is a manifestation of lack of movement and lack of energy within the tissues. And that occurs over time in chronic people, or it can occur from one day to the other when there's an accident or an injury. So we are here with John, and we're gonna do the second therapy, which is a shockwave therapy. Now, shockwave is a therapy that will stimulate soft tissues, but its primary work will be in breaking down older damaged tissue like scar tissue, and the body's own ability to heal will start to repair those tissues. So they work in tandem. The red laser and this one, they work fantastic in tandem, because one is gonna break down older tissue and the other one is gonna be healing tissues, okay? I already did laser on him, and that's gonna bring a lot of blood flow to that section and reawaken all those soft tissues, muscle, ligaments, tendons. Now with this one, what I want to do is I'm going to set it up here. I've already put some conduction gel on John's back, and this is gonna send an acoustic wave into the tissues, okay? It makes a sound here. And depending on the patient's presentation, it will change the amount of wave it will emit, and it will also change the frequency and the pulse that it emits. The purpose of this one is very similar to laser in the sense that it is meant to decrease inflammation and heal the tissues and really shorten the amount of time to recovery. So again, depending on the patient, I will use this machine anywhere from 2 minutes to 5 or 10 minutes. It depends on the patient presentation. In the case of John, I will spend a good 4 or 5 minutes just doing this to really get rid of that scar tissue and allow that whole region to regenerate over time. Okay, so I'm here with John and I'm gonna adjust his low back. Okay, so I already know the segment I want to adjust, which is L4 and L5. So I'll just touch on those segments with my index fingers, and then I'm gonna put rotation here. I'm gonna go here, take a deep breath, all out, yeah, boom. So I'm gonna adjust John's upper back now. Let me have you give yourself a big hug, John. I'm gonna rearrange here, make it bigger for him, and I'm gonna turn him towards me. I'm gonna place my hand right before in the bottom of the segment I want to adjust, and then I'm gonna go. I'm gonna do it a little bit lower, same thing, all out, yeah. There you go, awesome. And that's the thoracic adjustment. Okay, so we are here with John. I'm gonna do 2 things with his cervicals. I'm gonna do a rotation adjustment, which is the most typical chiropractic adjustment. And then I'm gonna do a decompression of the cervicals with a rapid decompression, okay? Spinal decompression. So for him, I have already identified the regions I want to adjust in the upper cervicals, okay? So what I'll do is I'll go here to the right, and then once I position my hand, most people think that what I'm doing is a full rotation. What I'm really doing is a repositioning of the vertebra. So I come behind here, and then 3, boom, I go there. And that's already set up. And then I'm gonna come to the other side. I'm gonna do the same thing here. I'm gonna bend slightly, and I'm gonna go here, and boom, and there you go. Okay, so we're here with John, and we are gonna do the second cervical adjustment, which is gonna be a decompression. And it's really a complete spinal adjustment. What I'm doing is a global distraction or decompression of the whole spine, but I'm doing it through the cervicals, okay? So when I'm done, John is already set up. What I'm gonna do is I'm gonna put a towel behind his neck. I'm gonna go around the head, okay? This is called a rapid spinal decompression, as opposed to the machine decompression, which is over time, it has less pounds of pull. This one has more pounds of pull with my arms, but it's much less time, okay? So what I'm gonna do is I'm gonna pull on his head, basically through the towel. I'm feeling for the stretch of all the soft tissues, okay? And then once I reach that stretch, I create a pull. Okay? And that's it. That is a spinal decompression. That spinal decompression goes all across the spine down to the lower segments.